The goal of this project was to probe a common clinical phenomenon, the patterns of maladaptive, costly avoidance seen in clinical anxiety. So anxiety patients often report that a lot of their time and effort goes into avoiding potential threats, and that this gets in the way of pursuing their goals and values. Of course, avoiding threats is often an adaptive behavior that helps us survive, but the kind of threat avoidance that can become maladaptive is the kind that involves relinquishing some valued reward. In other words, avoidance is relevant to anxiety disorders when it occurs in the context of approach avoidance conflict. One example of this is someone considering the possibility of going on a road trip with friends. So going on the road trip could be rewarding and fun, but it could also confer all kinds of risks, such as getting in a car crash, that one could avoid by staying home. In a situation like this, the goal is to appropriately weigh the pros and cons of each option. But what we see in the clinic is that anxiety patients often demonstrate a bias toward avoidance, so that reasons to avoid are systematically given more weight than reasons to approach. We wanted to probe this kind of bias by looking at the interplay of neural systems that support fear excitation and systems that support fear inhibition. We expected that adaptive approach behavior under conflict would rely on the ability of fear inhibition systems to override fear excitation, and that those with a bias towards avoidance might have faulty fear inhibition and/or excessive fear excitation. In line with the dimensional transdiagnostic aim of this project, we hypothesized that across anxiety-related diagnoses, this kind of bias would be associated with anxiety sensitivity, which is a measure of the extent to which anxiety itself is perceived as dangerous or harmful. And so we recruited a large transdiagnostic sample of adults with current anxiety and trauma-related disorders, and a sample of healthy adults with no psychiatric history. Our participants completed a measure of anxiety sensitivity, which, as expected, we found to be elevated in patients. Next, during fMRI, our participants completed the Pavlovian instrumental generalization paradigm, or the PIG paradigm. And this is a previously validated task from our lab that elicits Pavlovian fear, instrumental avoidance, and generalization under approach avoidance conflict. So in the task, participants are told that they're a farmer who travels between a shed and a garden to harvest crops. The task starts with an acquisition phase where the long road is closed, and participants passively watch the farmer travel the short road to get the crops. So this phase consists exclusively of Pavlovian trials. Participants are told that while the farmer is traveling, they might be at risk for shock, and that they should pay attention to the shape presented in the middle of the screen. That shape could be the CS+, which is shown here as the large ring. For half of the participants, the CS+ was the small ring. And so that CS+ is paired with shock. The CS- shown here as the small ring was never paired with shock. And a triangular CS- included to control for any generalization to all rings was also presented and was never paired with shock. Next is the generalization phase. So in this phase, middle-sized rings are introduced with varying resemblance to the CS+. These rings are also safe, never paired with shock. And during this phase, we also open the long road, and participants are told that on some trials, they will now be able to choose a road. Each road has its costs and benefits, so we tell participants that the long road is always safe, but because it's so long, a flock of birds might come and eat the crops before the farmer gets there, so they're unlikely to win that trial if they choose the long road. Whereas the short road means that they would be very likely to win, but just like before, there's a risk for shock. And so they should keep paying attention to the shapes in the middle of the screen. And so now during this phase, in addition to our conditioned Pavlovian fear, we also have instructed instrumental avoidance, if we define avoidance as taking the long road. Of note, during this phase, avoidance is always costly and is sometimes unnecessary. So because the CS+ is paired with shock, avoiding during the CS+ we can think of as adaptive avoidance, but because no other stimulus is paired with shock, avoiding during any other stimulus can be thought of as maladaptive avoidance. Here's an illustration of the time course of different trial types. So all trials start with stimulus onset. On Pavlovian trials, they would passively watch the farmer travel, and at times are asked to rate their risk of shock in that moment. And then on instrumental trials, they get a choice prompt, 8 seconds to contemplate, and then make their choice. And then all trials end with an outcome, and that outcome could involve shock and could also involve winning the trial. Instrumental trials had one of 2 sets of win probabilities, and these were explicitly cued on screen. So as you'll see on the left, some trials were certain win trials where the short path confers 100% chance of win. And on the right, other trials were uncertain win trials. Winning on the short path is less certain. So again, if we define avoidance as taking the long road, avoidance is more costly on those certain win trials because participants are giving up a sure thing of that certain win. In addition, if the stimulus is safe on a certain win trial, avoidance is also more maladaptive on these trials. And so looking at our results here, the first thing is a manipulation check. We confirmed that self-reported shock expectancy when shown across stimulus types is elevated to the CS plus, indicating successful acquisition of conditioned fear, and follows a gradually sloping gradient as the stimuli perceptually differentiated from the CS plus. So this indicates generalization of shock expectancy from the threat cue to its safe approximations. We then identified neural substrates of Pavlovian fear by examining brain responses to stimulus onset with a CS plus versus triangular CS minus contrast. And the CS plus elicited deactivations of VMPFC, which putatively reflects fear inhibition, and activations of hubs of the salience network, which could reflect threat salience or motivational relevance of a threat cue, as well as activations of hubs of the frontoparietal control network, which is thought to reflect cognitive control and or emotion regulation. And all of these findings are consistent with what we've seen previously in our lab and from other labs. And as expected, these neural substrates of Pavlovian fear are also coding for generalization. So 3 of them are shown here. We then assessed the effect of anxiety sensitivity on responding across stimuli in these regions. And we found that in the anterior insula and in the dorsolateral prefrontal cortex, there was a main effect of anxiety sensitivity, as well as a stimulus by anxiety sensitivity interaction that reflects what looks like a blunted response among those with higher anxiety sensitivity to the CS plus and its closest approximation. This likely reflects a ceiling effect and is consistent with other findings we've seen in our lab. So a higher baseline state of anxious responding would yield these kind of blunted gradients because the brain responses are normalized within each subject. And now moving on to instrumental avoidance. So as expected in both types of instrumental trials, participants are avoiding the most to the CS plus, and this avoidance generalized across stimuli. So we're seeing maladaptive generalized avoidance to those middle-sized rings. And also as expected, there's less avoidance overall on the certain win trials shown on the left, consistent with the idea that avoidance on these trials is more costly. And then looking next at the effects of anxiety sensitivity. So there was no significant effect on the uncertain win trials, but on the certain win trials, where again, avoidance is most costly, we see a significant effect of anxiety sensitivity and a stimulus by anxiety sensitivity interaction, indicating more avoidance and more generalization among those with higher anxiety sensitivity. You'll note that the slope from the ring-shaped CS minus to the GS2 is flat for the low anxiety sensitivity groups, so the gray lines, but is relatively steep for the higher anxiety sensitivity group. And a follow-up analysis confirms that anxiety sensitivity does correlate with that slope or with the difference between these responses. And so this indicates overgeneralization of avoidance in higher anxiety sensitivity. Those with higher anxiety sensitivity are not avoiding the safety cue, but they do start avoiding at lower levels of threat cue resemblance. And this is consistent with the idea that anxiety sensitivity is enhancing avoidance motivation. So to further understand what might be driving this elevated maladaptive avoidance, we next looked at maladaptive Pavlovian instrumental covariation. This is the extent to which a person's Pavlovian responding to a generalization stimulus corresponds with their propensity to make a maladaptive avoidance decision. And more covariation in this context means that we found an index of Pavlovian responding that seems to be driving avoidance. Each subject got a generalization score for all Pavlovian and instrumental indices, and these generalization scores reflect the difference between average responding across the middle-sized rings minus the responding to the triangular shaped CS minus. And we performed moderated regressions to look at the effect of anxiety sensitivity on Pavlovian instrumental covariation. These plots show the generalization score for Pavlovian VMPFC responding on the x-axis. So the x-axis in both plots is exactly the same. And the generalization score for avoidance on the y-axis, with certain win trials on the left again, and uncertain win trials on the right. And so in the certain win trials, there was a significant moderating effect of anxiety sensitivity, so that greater VMPFC response to the GSs, moving to the right along the x-axis, corresponds to less avoidance for those with lower anxiety sensitivity only. So this suggests that for those low on anxiety sensitivity, safety-related activity in the VMPFC is able to attenuate maladaptive avoidance reflected in that downward slope, which enables them to pursue the certain win. But this relationship appears to weaken with increasing anxiety sensitivity. So the darker gray line reflects moderate anxiety sensitivity at the mean of the sample, and the red line reflects high anxiety sensitivity, 1 standard deviation above the mean. And this looks like a dose-response relationship. The higher your anxiety sensitivity, the less the VMPFC is able to attenuate maladaptive avoidance. On uncertain win trials on the right, you can see things are going in the same direction, but the effect was less robust and not significant. And so one interpretation of this is that for those with higher anxiety sensitivity, VMPFC activity is not enough of an inhibitory influence to outcompete fear excitation. And consistent with this interpretation, when we looked at the same analysis for fear excitation regions, we again see a significant moderating effect of anxiety sensitivity in those certain win trials. So these plots show effects for the generalization of right anterior insula along the x-axis, and then the same generalization of avoidance along the y-axis, indicating that for those with higher anxiety sensitivity, those with more fear excitation to GSs, moving to the right of the x-axis, were also more likely to make a maladaptive avoidance decision. Whereas looking at the dotted gray lines, those with lower anxiety sensitivity were still likely to approach and pursue the certain win, even when fear excitation was high. And we see a similar effect in dorsolateral prefrontal cortex. So suggesting that these neural substrates of fear excitation are overriding fear inhibition to bring about the costly, unnecessary avoidance in those with high anxiety sensitivity. And so taken together, these findings are shedding some light on the mechanisms of maladaptive avoidance. So our results suggest that in situations where avoidance is highly costly and unnecessary, so situations like the one we modeled in our certain win trials, when a safe stimulus was presented, in those kinds of situations, those with low anxiety sensitivity demonstrate Pavlovian responding in fear excitation regions and fear inhibition regions. And the fear inhibition is ultimately what seems to drive avoidance. In other words, fear inhibition seems to be effective at attenuating maladaptive avoidance, allowing them to balance the consideration of risk versus the sure thing of a reward. Whereas those with high anxiety sensitivity also demonstrate fear excitation and fear inhibition, but the VMPFC appears to be ineffective at attenuating maladaptive avoidance. And so avoidance tends to occur anytime there's sufficient Pavlovian fear excitation, regardless of what VMPFC is doing, resulting in a bias towards maladaptive avoidance over approach. And so this pattern of being unable to inhibit the avoidance motivation can now be explored as a potential target of psychological and pharmacological treatment. I'd like to acknowledge the ANCS Lab, my advisor, Dr. Shamal Lithik, and the NIH for funding this research.